ਡਾਕਟਰ ਸੰਜੀਵ ਗਾਂਧੀ ਕਿੱਤੇ ਵਜੋਂ ਡਾਕਟਰ ਨੇ, ਮੈਗਿਲ ਯੂਨੀਵਰਸਿਟੀ ਤੋਂ ਉਹਨਾਂ ਨੇ ਡਿਗਰੀ ਕੀਤੀ ਹੈ ਅਤੇ ਕਲੀਨਿਕਲ ਪ੍ਰੋਫੈਸਰ ਆਫ ਸਰਜਰੀ UBC ਦੇ ਸਕੂਲ ਆਫ ਮੈਡੀਸਨ ਦੇ ਵਿੱਚ ਲੰਬਾ ਸਮਾਂ ਉਹਨਾਂ ਨੇ ਕੰਮ ਕੀਤਾ। ਚੀਫ ਆਫ ਪੀਡੀਆਟ੍ਰਿਕ ਕਾਰਡੀਓਵੈਸਕੂਲਰ ਐਂਡ ਥੋਰੈਸਿਕ ਸਰਜਰੀ ਵਜੋਂ ਉਹ ਕੰਮ ਕਰਦੇ ਰਹੇ ਨੇ, ਚੀਫ ਵਜੋਂ BC ਚਿਲਡਰਨ ਹਸਪੀਟਲ ਦੇ ਵਿੱਚ ਲੰਬਾ ਸਮਾਂ। ਅਮਰੀਕਾ ਦੇ ਵੱਖੋ ਵੱਖਰੇ ਹਸਪੀਟਲਸ ਅਤੇ ਵੱਖੋ ਵੱਖਰੇ ਹੋਰਾਂ ਹੈਲਥ ਰਿਲੇਟਡ ਜੌਬਸ ਕਰਨ ਤੋਂ ਬਾਅਦ ਉਹ ਇੱਥੇ ਆਏ ਔਰ ਇੱਥੇ ਆ ਕੇ ਹੁਣ ਕੁਝ ਸਮੇਂ ਤੋਂ ਉਹ BC ਗ੍ਰੀਨ ਪਾਰਟੀ ਦੇ ਡਿਪਟੀ ਲੀਡਰ ਵਜੋਂ ਕੰਮ ਕਰ ਰਹੇ ਨੇ। ਉਹਨਾਂ ਦਾ ਪੈਸ਼ਨ ਹੈਗਾ ਚਿਲਡਰਨਸ ਹੈਲਥ ਅਤੇ ਉਹ COVID-19 ਨਾਲ ਜੁੜੀਆਂ ਹੋਈਆਂ ਬਹੁਤ ਸਾਰੀਆਂ ਹੈਲਥ ਪਾਲਿਸੀ ਨੂੰ ਵੀ ਸਾਈਜ਼ ਕਰਦੇ ਆਏ ਨੇ ਅਤੇ ਮੈਡੀਕਲ ਪ੍ਰੋਫੈਸ਼ਨਲਸ ਦੀਆਂ ਮੁਸ਼ਕਿਲਾਂ ਨੂੰ ਭਲੀ ਭਾਂਤ ਸਮਝਦੇ ਨੇ। ਸੋ ਆਪਾਂ ਉਹਨਾਂ ਦੇ ਖਿਆਲ ਸੁਣਦੇ ਹਾਂ। ਡਾਕਟਰ ਗਾਂਧੀ ਜੀ ਨੂੰ ਜੀ ਆਇਆਂ ਕਹਿੰਦੇ ਹਾਂ। ਹੈਲੋ ਡਾਕਟਰ ਗਾਂਧੀ ਜੀ, ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ, ਵੈਲਕਮ ਟੂ ਦ ਪ੍ਰੋਗਰਾਮ।
Dr. Ramana, thanks for having me.
Dr. Saab, we were just talking to Minister of Health, Honorable Adrian Dix, and our concern was the open letter written by the doctors of BC about the crisis that our system is facing. You being a doctor, you being a deputy leader of the Green Party, how do you see everything? The crisis specifically is a very scary word.
It's a very scary word, but it's a very accurate word. And there have been multiple reports. I mean, they come almost daily. As you know, just the other day, a group of healthcare professionals penned an open letter describing the toxicity at Surrey Memorial. Unfortunately, those doctors were forced to stay anonymous out of fear of retribution for speaking out, something that I experienced all too often. And that's been a huge problem in the healthcare system. We have no whistleblower protection for these healthcare workers, and a minister of health who denies the reality that doctors and nurses are bringing forward to the public in the public interest. And that sort of protection is mandatory for people who are willing to tell the truth about what's really going on in our healthcare system, which is in a major state of crisis.
How do you diagnose the major problems in our health system? Because we know that we've been crying for so long. We were highlighting the need for a bigger hospital or second hospital in the city of Surrey. And we were talking about shortage of doctors, shortage of nurses, and the wait times and everything. But you being a doctor, you being been there, done that, how do you diagnose yourself?
Well, I appreciate the question. I mean, I think that the focus is wrong. I don't oppose at all a new hospital in Surrey. It's more than overdue, but hospitals, buildings, they don't take care of people. People take care of people. And that's where we've lost our way. Just building buildings isn't going to fix the problem. We built a brand new children's hospital that opened in 2017. 30% of the beds in that hospital remain empty at least as of December of 2022. Completely empty because there's no staff to fill those beds. An empty bed is just an empty bed without a nurse and a doctor and allied healthcare professionals to be able to take care of the patients. So it's completely misguided to think that the healthcare crisis is going to be solved by building new buildings. I mean, Minister Dix talked to you a lot about things like the new agreement with Doctors of BC, the new Physicians Masters Agreement, and he quotes a lot of numbers. X thousand number of doctors signed on. It resulted in 500 new family doctors, and that work is done, I think was the quote. Well, that work is not done. That work hasn't even started. Mm-hmm. We don't know even what that work is, if you want the God's honest truth, because that Physicians Masters Agreement was signed, and trust me, I believe that family doctors need increased compensation. I'm the son of 2 family doctors. They're the most important physicians on the planet by far. But the PMA didn't have anything built into it to actually figure out whether that increased funding was going to solve the problem it was designed to solve, which was that 1 in 5 British Columbians don't have access to a family care doctor. There's no metrics in there. There's no accountability. So we don't know. If you ask Minister Dix or anybody 2 or 3 or 4 years down the line, did the increased funding to the family docs make it so that the 1 in 5 BC 1 in 5 British Columbians that don't have access to a family care doctor now do? Nobody will be able to answer that question. When you talk about the cancer announcement yesterday, I mean, that's just awful, right? I mean, that's just a complete indictment of our system. It's a major reality check in terms of how desperate the healthcare crisis has become. You have to use the word crisis when one of our most cherished social programs in Canada and British Columbia, universal healthcare, and we're getting bailed out by a system south of the border, which I worked in for 17 years, and from a societal perspective is much worse than ours. You can't keep blaming the Liberals. The NDP has been in power for 6 years. You can't keep blaming prior administrations for these problems. It's not about building buildings, and there's so many things that we're missing in this cancer announcement. Minister Dick said that Liberal MAs might be confused. Well, I'm confused. I'm confused about what this means, and if you want, I can talk to you about that. But it's not straightforward in the least.
It's a kind of a hypothetical question to you, sir, that let's assume that you are Premier, you are the health minister of the province now. How would you prioritize the process of fixing this crisis level of this health system? Where would you start? What would be your first steps?
I'm glad you asked the question. It's not that difficult of an answer. The problem is that healthcare, unfortunately, is run by politicians. I know you're talking to the now deputy leader of the BC Green Party, but I don't consider myself a politician yet. If Sonia
why is that? You are a politician already.
I equate politics to the need to be elected. Maybe that's wrong, but as an outsider, as a general lay person prior to January of 2023, politics to me is too much about what you need to do to win the next election. For me, I entered this arena, this job with the BC Greens, because I want to help make a difference in society. I don't really care that much about getting elected. I know that's the end goal in order to get things accomplished, but I really want to make change. And the BC Green Party and Sonia Furster know that's what they're all about. They don't really care who gets the credit as long as the population is well taken care of. So to answer your question, it's not that difficult. If I was the Minister of Health, the number one priority is accessibility to health care. And the only way to get accessibility to health care is to completely revamp the system. The UPCC model that's been set up by the NDP government is a disaster. The UPCCs are nothing more than glorified emergency rooms. They don't provide longitudinal family care. And what people have a problem with is accessing family care when they need it. And the way to do that is by setting up community health centers around the province where it's one-stop shopping. People can go, they can see their family doctor, they can see their physiotherapist, they can see their mental health professional. Mental health needs to be brought into medicine. It currently is out there somewhere. It's not considered part of real medicine, and certainly a healthy mind is just as important as a healthy liver or healthy heart. And so these community health center models would also allow doctors to focus on what they're specialized in, which is taking care of people. Doctors don't go into medicine to be business people. And right now, the way family practice is run across this province, you're asking all these doctors to be small businessmen or small businesswomen in addition to being healthcare professionals. We don't ask teachers to maintain the schools and to pay the janitors and to, buy the paper and blah, 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 all that stuff. We ask them to teach our children. And we should ask doctors to take care of our patients, not to run a business. So that's the way to improve access to care throughout the province. That's the number one thing that needs to be fixed. The number two thing that probably needs to be fixed is the administration of healthcare in this province. The way that it's administered through 7 health authorities is ludicrous. It's just levels of bureaucracy that are unnecessary and don't contribute to positive outcomes. We have 60-plus vice presidents amongst the health authorities, all making around $400,000 a year. And there's a duplication of work there that is completely unnecessary. It's redundant and costly, and the money could be better put elsewhere. So the whole administrative structure of healthcare in British Columbia is broken, and that needs to be fixed. And if you may be Minister of Health tomorrow, those are the things that I think could be done relatively easily if one had the will to make big change. And you asked about politics at the beginning. I often hear the response that, well, there's no political will to do that. There's no political will to do that. This isn't about political will. It's about taking care of people. That's what the job should be. The job should be to make sure that you and your family and your children, your neighbors and your friends are well taken care of. And right now, nobody can deny that that's not the case for a significant proportion of the population in this province.
A few days back, I heard you on 980 CKNW, and I was quite impressed the way you, explain everything. This is a very complicated issue, but you being a doctor and you being a vocal critic on this subject, you can very much explain everything. So I wish that you would have been a part of the government, but sorry, you chose the wrong party.
Well, I don't know why you say that. Well, I mean, it's only the wrong party if you think the BC Greens can't win.
No, it's not a wrong party because I don't like it. It's wrong party because chances of forming the government are very, very remote.
Well, with that mindset, yeah, they're remote, but that's the mindset we need to change. If you want a party that cares about people, if you want a party that cares about British Columbians and not just about getting elected or their pensions, then the BC Green Party is the party for you. People have a misconception that the BC Green Party is all about the climate and the environment. And while the climate and environment are extraordinarily important to our future, probably the planet's biggest problems, those problems intersect with all the other social problems that everybody cares about, whether it be healthcare, financial stability, housing, all of that stuff intersects. And the BC Green Party is the only party that consistently champions all of those other issues, putting people at the center of all of the problems. So I don't consider myself as chosen the wrong party. I think I chose the exact right party. It's now the job of the population to do the same and choose the right party if they want real change in this province.
And Doctor, lastly, I guess you're not born in India, but you were mentioning about the community health centers and all that. Rather than sending our cancer patients to states, why can't we have doctors from India, Pakistan, from all other countries of the world who are driving taxis and doing some security jobs and etc.? Why can't we fasten the process of bringing them in to our system? That's a $1 million question, but you may have answer for that.
It's not a $1 million question. It's an excellent question, and it's not a $1 million answer. If you want the God's honest truth about that, it's because of the encumbrances at the BC College of Physicians and Surgeons, which make it extraordinarily difficult for somebody who's been trained outside of this country to practice medicine in this country. Minister Dix also said that they're facilitating the accreditation of international graduates. That's just not completely accurate. It's a little bit deceiving. There's certain things that are being fast-tracked, but to become a full-fledged practicing physician in this province, if you're trained in India or Pakistan or anywhere outside of Canada or even sometimes the United States, is a huge encumbrance, a major problem. I mean, you say I wasn't born in India, which is true, but my parents moved to Nova Scotia, the east coast of Canada, when I was 1 year of age. They were in India, and then they came through the UK, and they came in the 60s to Canada when Canada was actually welcoming international graduates. There was a huge doctor shortage there, and that's why so many Indian doctors came in the late 60s, early 70s to Canada, because they welcomed them. I wouldn't be here. I wouldn't be talking to you today. I wouldn't have had all the opportunities that have been bequeathed to me by this wonderful country if it wasn't for Canada's open arms at that time. And now we're completely have completely shut the door, and it's abhorrent. I mean, the cancer thing is crazy. I mean, just do the math. I did the math today on the cancer thing, and Minister Dix says some people don't understand it. Well, I don't understand it because the government said yesterday that they're going to spend $35 million to take care of 4,800 people for radiation therapy in Bellingham over 2 years. So that's $7,200 a patient. Well, I looked it up. If you look at the Medicare reimbursement data in the United States, which is conservative estimates, the cost of radiation therapy for breast and prostate cancer ranges anywhere between $8,000 and $17,000 per person. So let's just say we'll use the lowest number, $8,000. Radiation is usually 5 days a week for a month to 2 months. Well, let's use the shortest time frame, 1 month. And let's stay in a really small hotel, in a really small room. I looked it up. On Orbitz, you can stay in the Days Inn in Bellingham for $360 for 5 days U.S., so that's $1,800 for 4 weeks. And let's eat on a budget. Let's eat poorly. $30 a day for 5 days. That's $600 for every 5 days. Bellingham is 90 kilometers from Vancouver. So we travel to and fro 4 times because we're only doing 4 weeks of radiotherapy, and we do it on 1 tank of gas because we fill up in Bellingham, and it only costs us $80. So even if you use all those assumptions, most of which are huge underestimates, that comes to $10,500 U.S. per patient, not factoring in a single administrative cost, which is going to be huge. I mean, Minister Dix used concierge service when he talked to you, or lost income, or support of any caregivers going with the patient that's getting radiotherapy. So that's $50 million, not 35 U.S. Today's exchange rate, that's $65 million for 4,800 patients. So take that $65 million and put it into our system, and couldn't we take care of those 4,800 patients a lot more effectively in British Columbia?
It was nice talking to you, sir, and we'll be in touch. I'm running short of time, but this is your first time in my show, and I really like talking to you, sir. You are very open and you're very expressive. You know the subject. Thank you very much for your time.
Anytime.